robots are being used in hip and knee replacement surgery procedures. Today we ask consultant hip and knee surgeon Mr. Jonathan Miles to explain the role of robots in assisting hip and knee replacement surgery and how it helps patients.
Hello, my name is Jonathan Miles and I'm a knee and hip surgeon working for the HCA Wellington Hospital. I see patients in the Wellington in St John's Wood and also in the satellite facilities in Golders Green and in Elstree. Most of the operations I perform are on the knee and hip and in the form of joint replacements. We do them down at the Wellington Hospital and we use a very special piece of kit called a Mako robot, which is what I'd like to tell you a little bit about today. It starts off with doing a CT scan, so we get an accurate 3D model of your joint, your hip or your knee that we're going to replace. We can then use that to do a kind of computer game version of your joint replacement before you even come into the hospital. We then know the exact size and shape of your bones, and we can use the exact right size and shape of implants for you. When you come into the hospital and during the surgery, we paint some boundaries around the sides of your joint. This means that the robot and I can't damage your ligaments, your tendons, and even vital structures like blood vessels and nerves that can be damaged in conventional joint replacement. Probably the main benefit is the robot arm that's with us during surgery. We can program this with the computer game version of your joint that we've already done. This means that not only are we getting the right sizes, but we can very accurately get the right position as well, down to under 1 millimetre and under half a degree of accuracy. So you get the right size, the right shape, and in the right place. In the hip, this can reduce the risks of some pretty serious complications. Dislocations and leg length discrepancies are an awful lot less common when done robotically, and those are two of the most major complications that can happen. In the knee, the most common problems are that they're the wrong size, or they're in a bit too loose or a bit too tight. The robot can help us by assessing the tension of tendons and ligaments around partial or total knee replacements to reduce the risks of these significantly. They're both big operations and there are still some other risks, but if you're having it done with a surgeon who's used to using a robot and using the most advanced robotic techniques, we can reduce a lot of these potential complications. I'm afraid there is still quite a lot of work to be done and you do need the help of some really good physiotherapists, such are available at the various Boost facilities run by Steve and his colleagues. We don't just do joint replacements, but if you would like to come and speak to me about arthritis problems or other issues with your hip and your knee, I'll be delighted to see you. I'm a real enthusiast for robots, so if you do want to come and speak to me in details about how they actually work, I'm very happy to explain everything we can about their facilities and why I think they're definitely the best way of having your hip or knee replaced. Thank you very much for your attention.